Christy does not like those little barcodes on her lips, and we're trying to resolve those and give her a little bit more volume in her lips. So I'm going to take off some of the numbing that we put already for her, and this is antiseptic, so we're just cleaning the area with antiseptic. I'm going to use the cannula because I really believe that the cannula is really one of the best tools we can use for the lip without causing too much trauma to the lip. So I make my opening with a needle in the corner of the mouth, and then I use the cannula, and then hopefully we can find the opening. That's the most difficult part of it. We are in here, so if you look, the tip of the cannula is right there. So I'm just going to put in the product, and I'm just putting it little at a time. You can see this is fuller than this. You can see a great difference already. We're going to go ahead and do the same thing on the bottom part, and we can make the same opening. Use the same opening and go to the lower lip. See my cannula again, the tip is right in the middle. So I'm just gonna go to the vermilion border, and I'm just injecting. This side has been treated. This is becoming more fuller. If I wanted to inject into the body of the lip, the same thing. I go with the same opening, but this time I go into the body. So if you look, it's a little bit different. So I'm a little bit lower than the vermilion border. So I'm going to just put a dab here. So I'm just going to give her a little fullness right there. So, and the same thing if you wanted to create the pillows in the lips, on the lower lips. So you're going to go to the same hole, and this time you're going to go to the body of the lower lip, and with holding this, I'm right in here. So I'm going to create the pillows, and then I come out. So this is how you can see the difference between this side of the lip and this side of the lip. I'm going to go to the other side and do the same thing on that side. I'm going to make my opening a little bit away from the corner of the mouth. So we're making the little opening with the needle, and I'm using the cannula again. You okay? Mm-hmm. So you can see I'm along the vermilion border. So you can see I'm right here. So I'm going to do the same thing. So I'm just going to inject slowly along the vermilion border. I'm right here now, so a little bit more, and that's it. And then look at it, make sure that they're even. The same thing here. I'm going to go ahead and start in the vermilion border like the way we did before. So, and now remember we did a little bit in the body, so we're going to do the same thing here. We're going to go and do a little bit in the body of the lip. And if you look at it, I'm in the mucocutaneous junction. So I'm just going into right in here and put a little droplet here. And that's it. So I want to make sure that it is even. I want to put just a tad right there. So when you look at it, she has a lot of wrinkles. So I'm going to put a little bit more right in that area. So again, I'm going to go to the vermilion border, because that's where I want to put a little bit. So now it looks good actually. And then I'm going to go to the body of this one in the lower lip and put a little bit in the body of the lower lip. Right in the mucocutaneous junction. So right here. Smile for me, talk for me a little bit.
How are you?
Doing well.
It's just numb, so I can't feel my lips.
Right, because it has lidocaine with it.
It feels good.
Yeah, and I think it's pretty even. I usually keep a little bit, so later on when the patient comes and there's a slight asymmetry, you'll be able to help them. Usually I ask them to come back in a week or so if there is any need for it.